name's Joel, and this is Domino, and we're excited to welcome you to the Austin Humane Society Veterinary Medical Clinic. Today, we're going to talk about some of the things you as pet owners need to know to be able to take care of your pets safely, specifically regarding to some of their medical care. So, we'll see how well I do this video, because Domino, I know, is quite rambunctious and is jumping around the table, but right now he's being awesome. So, to start with, I wanted to talk about some of the things as far as regarding approaching a dog and saying hi to a new dog that you don't know. And so there's some of the ABCs I wanted to go over. It's a good way for you guys to remember it. A, when you see a new dog out in public, you want to ask first. So A is ask for permission from the owner if you can approach their dog and go ahead and say hi to them. B, the second thing that you want to do, hi, is you want to keep in mind your body language and then the animal's kind of behavior towards your body language. So a lot of times, as you can imagine, I'm much larger than Domino is. It might be scary if I just ran up to him and said hello. And so I want to start by kind of thinking about what my body language looks like. So I'll approach a dog slowly. I might get down on their level where I'm kind of like the same level as them and I'm not looming over them. And I'll kind of watch how they respond. If they're curious, and they're kind of wiggly and have loose body language, then I'll be like, okay, this is great. And if they kind of get all tense and scared, then I'll also keep in mind that maybe I should back off. Then after that, I'll go ahead and let them sniff me, and I'll kind of put my hand out and let them sniff the top of my hand. And once they've had a chance, are you going to sniff my hand? No. Once they've had a chance to sniff my hand, I'll go on and move to part C. So C is you're going to want to start by petting right underneath the bottom of their chin. And if they're comfortable with that and they're okay with that, you can move to petting their neck, the top of their head, and down the center of their back. And so when you're petting them, you want to pet the same way that their hair is growing. So we're going to pet down. And at that point, I'm fairly comfortable with Domino, and Domino's comfortable with me, and so I can know that I can go ahead and pet that dog. But those are the ABCs of safely approaching a dog that you don't know. So let's slide you back for a second. The next thing that we are going to talk about today are some of the creepy crawly bugs that bother dogs and that also sometimes bother people. The first one we're going to talk about is ticks. And so this is a magnified image. This is someone's finger, and Domino's very interested in what's going on. And so those are 4 different ticks, different size ticks that are on someone's finger. So they can be really small. And basically a lot of times they'll hang out on the ears, sometimes they'll hang out in between the paws, and then sometimes they'll hang out in the warm kind of fleshy spots on their belly. But ticks basically will take blood meals. They can also spread some different diseases, and so we want to make sure that we're using some kind of preventative to keep them safe. We'll talk about preventatives in just a second. One of the other types of bugs we are going to talk about today are fleas. And so fleas also take blood meals, and these guys are super small. So the tip of a pen, or the tip of a pencil, so one of our writing utensils, they'll be really small. This is a magnified image, but dogs will get a handful of these on them, and they can spread tapeworms, as well as when they take their blood meals, they can take some of those important parts of the blood that dogs need to live nice and healthy lives. So we want to make sure we're using flea preventatives on them. Another thing that can happen, especially the older dogs, is they'll sometimes get what's called flea bite dermatitis. So they'll get itchy skin that causes them a lot of irritation, and they get that from a reaction to the saliva that fleas have when they bite. And so we want to make sure that we're using a flea preventative on some of those guys. If they can get one flea bite, it can cause them to be itchy for about half a year or so. And so if we're using a preventative, they're not going to have that itchiness. So that's a definite important one. The next kiddo we're going to talk about today, I don't know why I call it a kiddo, it's a gross bug, is a mosquito. So mosquitoes are those little guys that fly around and they bite you and leave welts on you. They can also bite dogs. When they bite dogs, what we worry about, sometimes they cause itchiness, but more often they'll actually spread heartworms. And so heartworms are a parasite that actually live in the heart. And I've got a kind of cartoon picture of what those look like. So there's this red heart, and those are some little white worms that are living inside the heart. Basically, they make it hard for the animal's heart to beat and to circulate blood throughout their body. And so, you're getting all rambunctious. What we like to do is use some heartworm preventatives to prevent them from getting those. So I've got 2 different preventatives I was going to show you today. One of them is our flea and tick preventative. It comes in this tube, and it's a liquid. And so the way that we apply that is, with a little rambunctious guy like him, we'd get someone to help hold, but we'd want to go ahead and part the hair right where their shoulder blades are on their back. Oh, you saw the camera. So we'll part the hair so we can see the skin, and then we'll squirt that liquid right on their shoulder blades. The nice part about this area is it's hard for them to turn and to lick it off if they don't like the way that it feels. So that way they're not getting those chemicals in their mouths. But that would protect them from fleas and ticks. And then the one that we would use for heartworms, this is a medication that he would actually eat. If you open it up, it kind of looks like a treat. And a lot of times they're flavored. I think this one's actually liver flavored. And so then that way they'll eat it and it'll protect them from getting those heartworms. So those are the two different preventatives we would use on this kiddo. There's a bunch of different kinds, but most of them work one of those two ways. They're either a pill you eat or a medication that goes on their back. Hi. Do you want to chew on a toy? Do you want to chew on a toy? It's a good thing to chew on. Yeah. Okay. So we've talked a little bit about how you approach a dog, and we've talked about some of the different like creepy crawly bugs that'll bother them. The next things that we were going to talk about today were heat safety. So as you guys know, it's summertime and it's hot, and so y'all are probably going to the pool as much as you can, or playing in a sprinkler outside in your front yard. With dogs, they don't sweat the same way that we do, and that's how we a lot of times will cool ourselves off. Our bodies will get a layer of sweat, and when it evaporates, that lowers our temperature. They're covered in fur, and so they already have that insulation, and they don't really kind of sweat that same way, so they don't cool off. It's harder for them to regulate their temperature. So we want to make sure that we're making sure that they're staying safe by helping them. If it's a hot part of the day, we want to make sure that there's either shade in the backyard or we have them inside where it's air conditioned and it's cool. We want to make sure we're providing water for them because they can get dehydrated when they get too hot, the same as we can. So with dehydration, basically what happens is the body doesn't have enough moisture and liquid inside of it, and so that can affect the way that the heart pumps blood and affect the way that the actual organs function. So there's two different ways you can kind of play with your animal to test and see if they're dehydrated. And so one of them is to go ahead and do what's called a skin tint test. And you'll pull up on the skin on the back of their neck, and if it snaps back into place like it normally does, then it's good. You don't want to pull so hard you're hurting them, but very gently kind of pull up. And like I said, if it snaps back into place like that, it is good. You don't need to worry. The other one is called a capillary refill time. So in their gums, where it's nice and pink, they've got capillaries, which is basically how the blood flows. They're really small blood vessels. So I'm going to poke one of them with the soft part of my finger or thumb and squish all the blood out of that area. And when my finger comes away, it'll be white. And then as the blood flows right back into that spot, it'll turn pink. It's going to be pretty quick, so you're going to have to see if we can get him still enough and to see it, but sometimes it's kind of difficult. Okay, so I'm going to lift up on his gums. He's got some gray pigment, so it's actually hard to do it on him. No. Let's see. All right, we can try. So I'm going to poke my finger, and when I come away, it should be a little whiter, and then it should turn pink pretty quick. Check it out on your dog if they'll safely let you kind of peek in their mouth. Definitely have a parent help you to make sure that you're not going to get hurt. But that's how we kind of do a capillary refill time test. So those are two different ways you can check and see if they're dehydrated. But the best way is to make sure that you're providing water and you're keeping them out of the heat during those warmer hours in the middle of the day, because that's really what's going to keep them safe. Got some competition. Okay, so the next thing that I was going to talk about was spaying and neutering your animals. Spaying and neutering are two different surgical procedures that we'll do to female or male dogs. Hi, you want your toy? That will do to female or male dogs that will help prevent them from having unwanted litters or having unwanted puppies, unwanted kiddos. So basically, he has already had a neuter procedure, and we know that from two different ways. One, he's got a little shave spot right here on his leg. That's where they placed an IV catheter to make sure he was staying hydrated during surgery. The other way, if we look between his legs on his scrotum, there's a little bit of glue from a surgical incision where they removed his testicles, and then a little green spot where his tattoo is. So the tattoo's nice because if he ever ends up returning to a shelter, which will never happen for you, I know. If he ever ends up coming back to a shelter, gets lost, and goes to kind of animal control, they can look at that spot and already know that he's had surgery and know that they're not going to need to do another surgery to try to remove his testicles because that's already happened. And basically that'll prevent him from having, from being the father to any unwanted puppies. Yeah, I know. Here we go.
Hi, my name is Sheila and this is Avery, and today we are getting a bath. So we started by getting some really nice warm water and getting her full body wet, trying to avoid her eyes, ears, and nose. And then we got her all wet, and then we applied the shampoo, again, avoiding her eyes, ears, and mouth. And now we are just lathering her up, trying to get all her body parts, getting her little feet. Getting her nice and lathered. Good girl. I know. All right, so I've gotten everything. Made sure to get her belly, her feet, her tail. She's nice and clean. Now we will rinse. Again, we don't want to get anything in her eyes. Oh, I know, I know, I know. It's okay. Good girl. Okay, Avery. It'll all be over soon. Okay, now we're gonna let her shake. Maybe she doesn't want to. Let's see if she'll shake now. No, you don't want to shake? Okay, and then now we're gonna dry her. Good shake. Make sure that she's all nice and dry. And that's how you give a bath.
I've got Blueberry here with me to help me talk to you about some of the different medical components of what we do to care for cats here at the Austin Humane Society, and things that you can do at home to help care for your cat. So to start with, Blueberry and I were going to talk to you about approaching a cat. As you can see, Blueberry is comfortable with me, so she knows me and is comfortable with me petting her and interacting with her. If you're interacting with a cat you don't know, and sometimes even your cat, you want to make sure that you're nice and calm. You don't use loud voices when you're around a cat. When you're going to approach a new cat, a lot of times I'll let them smell my finger and sniff me to kind of warm up to me. If they're okay with that, I'll gently pet them from their head to their tail. And then the other thing to talk about that's important is when you're picking up a cat, to make sure that you don't only hold part of the cat, but you support the whole thing. So you want to put your hand in front and behind the cat to lift them. Blueberry is just kind of waking up, so I'm not going to mess with her too much, but just kind of let her sit here and play with her toys. The other thing, one of the other things we were going to talk to you guys about today is some preventative medications. So some different medications you can put on your cat to help protect them. Specifically, some of the things that cats get are some creepy crawly bugs that can bother us, also bother them. The first one is one I'm sure you've seen. It's called a mosquito, and they bite you and can cause irritated skin. With cats, they can rarely, but they do cause them to sometimes get heartworms, which is a parasite that can live inside their heart. The next one I was going to talk about are fleas. These are pretty small little kiddos. This is a big picture, but a flea is a bug that will bite them and then cause them to be irritated. If the cat were to eat the flea or the flea larva or eggs, they can actually get tapeworms, which will be an intestinal parasite that lives in their stomach and makes them kind of feel a little irritable. The third one we were going to talk about are ticks. So you can see this is a picture of someone's finger. So those ticks are super tiny. Ticks will actually bite them and can cause them to get a couple of different illnesses that again also make them not feel so great. So what we do to prevent these things is we use a type of medication called a preventative. And so this one is a topical medication. It's a liquid that will go right along her spine. So what we'll do is we take her and we'll part the hair right above her shoulder blades, so that we can see the skin. And that right there is the line where you would actually take this and squirt this medication. And so when you squirt that on her, it will protect her from getting those different parasites. Another thing you can do for cats is use what we call a flea comb. And so this is a flea comb that has very small tines or teeth. And so they're nice together and they'll actually catch some of those fleas. And so you can actually comb a cat by running it down their back and making sure you get the hair to go through those tines. And she doesn't have fleas, which is good to see, but if she had fleas, you would see some fleas on there. The other thing you might see is what we call flea dirt. So fleas, they take little blood meals when they bite, and so when they poop, they leave what we call flea dirt, because flea dirt sounds better than flea poop. If you get some of that flea dirt and you put it on a wet paper towel, it should turn kind of a reddish color, but that's how you would tell it different from just dirt if a cat was an outdoor cat that had dirt. So that's kind of what we were going to talk about as far as all of our little parasites here. The next thing that we are going to talk about is our vaccinations. So cats can get different viruses and different bacteria and illnesses from them. And so what we do is we use what are vaccines to protect them. So this vial right here has a diluent or a liquid. And so we would draw that up with our syringe and our needle and then inject it into this vial, which has a powder. And when we mix those together and reconstitute them, it creates a liquid that we would draw up with that syringe, and then we could squirt underneath their skin. And so when you do that, it'll protect them from getting those viruses, and it'll protect them from some of those illnesses that come from those different parasites. So that's kind of the way that our vaccines work. The next thing that I was going to talk to you guys about is spaying and neutering. For a shelter, that's one of the things that's really important to us, is making sure that pets are spayed and neutered. That'll prevent them from having offspring, which helps limit homeless pets and helps lower the pet population. So Blueberry's a little young, so she hasn't been spayed or neutered yet, but when she gets old enough, we will, and again, that'll help prevent us from having unwanted pets that are homeless. So that's the importance of spaying and neutering. The next thing we are going to talk about is eye and ear medications. So there's some different things that cats can get that cause them to feel sick, and their eyes and their ears. So I have an empty bottle that I was going to show you guys how we do those medications. But before I do that, I was going to show you a couple different things that we use our microscope to look at. And so I've got an example of our microscope over here. And so in their ears, we'll sometimes see different bacteria. So you can see this little arrow is pointing to one little yeast bud. So yeast is a bacteria that can live in their ears. It's shaped somewhat like a peanut or shaped like kind of a swollen bowling pin. But those little guys can live in their ears and cause them to have itchy ears. Another bacteria they can have kind of just looks like a little dot, like a little poppy seed, and that's what we call cocci. So those can also live in their ears. The third thing I was going to show you guys is this video right here. And so these are ear mites. And so these little bugs can live in the ear, and they move around and are kind of creepy crawly, and the cats can actually hear them, and it can cause them to have itchy ears and be kind of irritated. So to treat all of these, we use different ear medications. Again, this is an empty bottle just to show you kind of how we would do it, but we would take the top off and then take the kitty cat, tilt their head up, and then put a little drop in that ear, put a little drop in that ear, and then massage the base of the ear just to make sure that that medication is coating all the little ear canals and all the parts of the ear. If we were going to treat their eyes, because sometimes they can get some eye infections and cause their eyes to be swollen and red and irritated, you kind of hold their head up, you pull their eye open gently with your fingers on each side, and then put a little drop, and then again do the same thing in that eye. I use my pinky to pull down and my thumb to pull up, and just put one little drop right there. Again, there's no medication in this, so you shouldn't have seen a drop, but that's just how you would do it if you needed to medicate your cat's eyes or ears. Then that is kind of what we had today for our medical care on cats. I hope you enjoyed it and look forward to seeing you next week.